Recovery after the gynecomastia treatment, if we do everything through your armpit, so we avoid scars on the chest, if we use that technique, this is what's involved with your recovery. You're gonna have a drain coming out of your armpit incision on each side. That drain generally stays in place for a few days up to a week. I'm happy to remove it after 2 to 3 days if it's driving you crazy. However, the longer we leave it in, the faster you are going to heal. The other thing I need you to do is take it easy. The most common complication after gynecomastia is bleeding or hematoma. You can help prevent that by staying calm and relaxed during the early recovery period. So wear your compression. I'm going to put you in a compression vest at the end of the procedure with foam. That's going to do a nice job squeezing and hugging your chest to provide some gentle compression. Other than that, I need you to relax and don't work out. You can work out 1 week after your drains come out. So 1 week after your drains come out, you can work out, and you can work out only if you're wearing compression. Now, you don't have to wear the compression vest I put you in to create the compression. You can wear a tight compression Under Armour shirt. That's fine, as long as your chest has some compression squeezing that skin down to the muscle layer of your chest. That is what we need. You can shower after 24 hours. You can go swimming and go underwater after 3 weeks. But the biggest thing to remember is you can't work out or exercise or increase your blood pressure for 1 week after the last drain comes out. So if I take your drains out 3 days after surgery, you can exercise 1 week after that, which would be 10 days after the surgery. And when you're exercising, you need to wear a compression garment to squeeze that skin down against the muscle layer of your chest so that you don't develop swelling and fluid collections in that area. I need you to wear a compression vest or compression shirt for 2 months following the operation. Now, you can take it off to shower and you can cheat a little bit here and there, not while you're exercising though. But after a few weeks, if you want to go to the beach or go out on a boat or something, it's okay if you're out of compression for a little while, but especially for the first 2 to 3 weeks, and as much as you can after that, I need you to wear some compression to help hold that skin down while you're healing. There will be sutures in your armpit incisions. These are deep dissolving sutures as well as superficial sutures on top that we will cut out within the first week of your recovery period. The last point I want to make is that your skin will be somewhat numb following the operation. This is temporary, but initially following the operation, your chest skin will be far more numb than you are used to. So it's important that you don't put ice on it for any extended period of time because you could give yourself frostbite and not know it. You can also decrease the blood flow to the skin, which can cause skin necrosis. So I would avoid using ice at all. The other thing is, if your compression garment is wrinkled up and too tight, it can dig into your skin and actually kill the skin in that area from too much pressure, and you might not notice it because you're temporarily numb. So make sure whatever you're using to compress that skin down, if you choose to wear an Under Armour shirt or something different than what I put you in, make sure that it's not creating any creases or wrinkles that are digging into your skin. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.